Hello everyone, my name is Huang Xiaoli. I work in the Department of Medical Laboratory of Fujian Province Hospital. In this class, I will introduce the plasma protein and immunity function examination. There are so many kinds of proteins in our body. In this part, I only introduce some kind of plasma protein which are more important for us, including the stem protein, albumin, globin, C-reactive protein. At the same time, I will introduce the stem protein electrophoresis, which is a kind of technique to separate the stem protein, through which we will see the old serum protein in the graphs. Different proteins located in different positions according to the molecular weight. When we talk about the immunity of our body, I will immediately think about the immunoglobulin and lymphocyte. However, there are other proteins or molecular participating in the immunity, for example, complement or lymphocyte surface markers. Firstly, we will talk about the plasma or serum proteins. This is the tube of blood, which was added one kind of anticoagulant. If we centrifuge the tube in 3,000 RPM for 5 minutes, the tube of blood will be shown just like the picture of this slide. The upper part is plasma. The middle part is WBC, white blood cells. The end part is red blood cells. So the composition of the blood is plasma and blood cells. 91% of plasma is water. Proteins only constitute for 7%. Blood cells include RBC, WBC, and platelet. What is the difference between plasma protein and serum protein? If we added anticoagulant, the blood does not coagulate. Centrifuge the tube of blood. The upper part of the tube is plasma. On the contrary, no coagulant was added in the tube. The blood will coagulate. The upper part of the tube is serum. So whether it has the fibrinogen is the difference between serum and plasma. In all, plasma protein are equal to the serum proteins plus fibrinogen. Serum total protein is often from 60 to 80 grams per liter in adult. The children less than 3 years old will be lower. Albumin constitutes 60% of serum total protein, and the concentration of albumin is from 40 to 55 grams per liter. Globin constitutes for 40%. The centrifuge of globin is from 20 to 30 grams per liter. Under physiological conditions, the ratio of albumin and globin is in a steady state. The ratio of albumin and globin is from 2 to 2.1 versus 1. Albumin and some globins are synthesized in the liver, but immunoglobulin are produced by blood plasma cells, which is the difference between the albumin and globin. Serum total proteins has its very important clinical significance. And serum total proteins is most due to the reduction in albumin. So the cause of decrease have some about 3 causes to make the serum total protein decrease. The first one is the synthesis decreasing. For example, the cirrhosis. The second one is the catabolism increasing. For example, the malnutrition. The third one is the loss of protein from the blood to the other species. For example, the renal dysfunction. When serum total proteins was less than 60 grams per liter, or albumin is less than 25 grams per liter, the patient was suffering hyperproteinuria, which will result in edema and effusion in body cavities. Pleural effusion, perineal effusion, and pericardial effusion is the most common effusion. This picture is the pleural effusion. The left picture shows a perineal effusion. The right picture shows a pericardial effusion. Hyperproteinuria is much rarer than hyperproteinuria, which can be seen in the dehydration or some in the acute phase response to the infection or tissue injury. Gamma globin increase can also make serum total protein increase. For example, multiple myeloma or some like SLE. Just now, I finished the introduction of serum total protein. Serum total protein means the total protein in our body. A lot of diseases can make serum total protein decrease. So our students need to know. Next, I will introduce the albumin, which is very important for us. Albumin is synthesized in the liver. The reference range is from 40 to 50 grams per liter. Ratio is from 2 to 2.5 versus 1. When albumin decreased and globin have no change or increase, the ratio will decrease. When the ratio is less than 1, we call it the albumin versus globin inversion. which means albumin was lost seriously, and we need to find the cause and correct it. Albumin can keep the plasma colloid osmotic pressure, can also provide amino-acid sources, and can transport bilirubin-free fatty acid harmonies, etc. So albumin is very important for us. There are so many causes to make albumin decrease. Synthesis decrease, for example, cirrhosis, and the second is the catabolic increasing, for example, the malignancy. The third one is the losses of albumin, for example, the renal dysfunction. The other causes to albumin decrease, I will introduce two, because for example, the malnutrition, pregnancy, and congenital defect of albumin synthesis. The three kinds of protein I want to introduce. The three kinds of protein I want to introduce is CRP. C-reactive protein were originally discovered in the serum of patients with acute inflammation, which can react with the C polysaccharide of pneumococcus. So this protein is called CRP. The shape of CRP is like a ring, which have pentameric structure. CRP belongs to the acute phase reactant. It rises rapidly after the inflammation and shows a large increase and short half-life of 19 hours. It is also a non-specific inflammatory indicator, and CRP is produced in the lab too. What is acute phase reactant? Acute phase reactant are group of protein whose plasma concentration changes in response to an alignment of inflammatory standards, for example, infection, surgery, trauma, myocardial infarction, malignancy, and other conditions associated with the tissue necrosis. When our body is in the acute phase reactant, alpha-1 antiprotease, CRP, fibrinogen, hemoglobin, and the serum amyloid A will increase. So the protein just I mentioned all belong to the acute protein reactant. CRP has its very important clinical significance. CRP is a sensitive, rapid, non-specific inflammation indicator. CRP can also distinguish bacterial infection and virus infection. CRP levels can also used to follow patients with the autoimmune diseases. High sensitive CRP can also be used to be an independent risk factor for coronary heart disease. This picture shows the CRP, how CRP can make the atherosclerosis progress. Semiconductor forces. Such a protein can be separated into 5 regions by electroforces. Albumin, alpha-1, alpha-2, beta-gamma. The first and biggest region was albumin. Alpha-1, alpha-2, beta-gamma are next to the albumin in order. This picture shows the electroforces. Every protein, though, has its special protein. Alpha-1 antiprotease, alpha-1 lipoprotein belong to the alpha protein, and alpha-2 microglobin, hepatoglobin belong to the alpha-2 protein. Transferrin, hemopexin, complement 3 beta-lipoproteins belong to the beta protein, and all kinds of immunoglobulin belong to the gamma protein, and immunoglobulin can also cause as the gamma globin protein. A variant of disease and physiological alteration can affect protein electrophorese partners. For example, when the patient has the polyclonal composite, and the electrophorese graphs will be shown broad bank increase in gamma globins. Monoclonal composite, we will see a M bank, narrow M bank within the globin zone. It is generally called as M component. Nephritic syndrome, we will see the albumin will decrease, alpha-1, alpha-2, and beta protein increase. And gamma globin near, we will see the gamma globin zone decrease. Exudative enteropathy, we will see all of the protein will decrease. Cirrhosis, we will see the albumin protein decrease, but the gamma and beta protein increase to form the beta and gamma bridge. This picture shows all kinds of the electrophorese of all kinds of disease. And according to the shape, we will initially to assess the disease and to assess the patient's condition, which is a very special character of protein electrophorese of in the cirrhosis.